Leader of the Official Opposition.
Mr. Speaker, more New Brunswickers than ever are struggling to make ends meet. I was speaking to a dad from a family where he and his partner both work good jobs. They have 2 teenage kids, and he finds himself at the end of this month stretching to cover all his bills. On September 27th, the Minister of Finance said he would unveil new affordability measures, likely to include tax cuts, and these measures were just weeks away, as reported in the Telegraph Journal. Puis, le gouvernement a changé d'avis. Last week, as reported by Global News and l'Acadie Nouvelle, the Premier said that his cost of living measures were in limbo due to the possibility of an election that he hadn't decided on. Realizing his mistake, the Premier changed his tune again, this time saying he can't commit to help New Brunswickers yet because he isn't sure of the province's fiscal situation. Could the member opposite please set the record straight? What affordability measures are you considering? How much do they cost? When can New Brunswickers expect a decision and some relief? Because the dad I spoke with needs it today.
Minister of Finance and Treasury Board.
Yes, thank you, Mr. Speaker. Yes, the affordability measures are something that are before Cabinet. As we know, the Cabinet confidentiality rules are explicit. But I mean, we discuss a number of different things, a number of affordability measures, a number of changes, a number of things that are needed by New Brunswickers regularly. And so, yes, those are still in the works, and we're still looking at ways, and we're always looking at ways. I could reel off my list, but I won't do that. The member from Bath, please.
Oh, yes, please do that.
You know what? Let's start with, first of all, how about going back to what we talked about a little bit last week, which is the federal, your kissing cousins in Ottawa, who are, I think that's an all right saying, really, who are responsible for the carbon tax. How about reducing that? And that would help a lot. But anyway, inflation, rising fuel prices are all global issues, not just Moncton issues, not just New Brunswick issues, not just Canadian issues. They're all issues for all of us. And as a matter of fact, the inflation rate is going down. That is at least some help. And we continue to do lots of...
Thank you, Minister. Chef de l'Opposition of Hessian.
I appreciate things that are before Cabinet are confidential, but New Brunswickers are looking for the information that you said was coming. Could you give us a timeline? When can New Brunswickers expect relief measures from your government?
Minister of Finance and Treasury Board.
You know what? We continue to do a number of things. Just last week, the low-income seniors benefit, that was announced. And, you know, we have announcements regularly. We have announcements regularly to help inflation factors, to help all New Brunswickers. I mean, you know what? The personal income tax reductions that we've talked about has been a help for a number of levels of New Brunswickers. Provincial property tax rates, and we're going to be announcing another one this afternoon. For property tax, Mr. Speaker. So that is coming up shortly. There are a number of, this afternoon. This afternoon, when? This afternoon. It's going to be announced this afternoon. During, you know, when I get to do whatever it is, first reading on the bills, okay? So yeah, that's coming up this afternoon. Another way that we're helping New Brunswickers, this time it is helping people who are in residences for seniors. And we'll talk more, Mr. Speaker, but there are numerous ways that we help New Brunswickers every week, every day here, and that's what this government does. We do the work, Mr. Speaker.
Leader of the Official Opposition.
Mr. Speaker, I believe everyone in this House can agree that the best form of health care is preventative. The best way to reduce the strain on our hospitals and ERs is to prevent people from showing up there in the first place. One of the main causes why people end up in the hospital this time of year is RSV. RSV is very common, very severe, highly contagious, and it's a virus that affects younger and older New Brunswickers primarily. L'année dernière, nous avons connu le plus grand nombre de cas de VRS en 10 ans. La Société médicale a exhorté les gens à se faire vacciner contre la VRS. This month, I heard from people across the province and residents in my riding, like Senior Pat Flanagan of East Bathurst, who's on a fixed pension and faced an almost $300 charge for the vaccine. We can all agree that it costs New Brunswick more to provide care to a patient in the hospital for a day than the cost of this vaccine. On Respiratory Therapy Week, could the Premier explain to Pat from East Bathurst the decision not to cover the RSV vaccine for seniors?
Thank you. Minister of Health.
Well, thank you very much, Mr. Speaker, and this is an important file, and I do want to congratulate the people that the 21,000 people that have already received their flu vaccination and COVID vaccination. That's good prevention. Mr. Speaker, this government invests over $20 million in immunization to protect the people in the province of New Brunswick. $20 million. And Mr. Speaker, we are aware of RSV. We are aware of the results from last year. We don't need to take any lessons from the opposition. But we also want to take the advice from the experts. The National Advisory Committee on Immunization has not yet released their recommendations on this particular vaccine. So once we receive these recommendations, we will take that information and we make a decision moving forward. So the last chapter hasn't written, but in the meantime, we continue to ask people to get their flu vaccination, get their COVID vaccination. If they're sick, stay home and take all the other.
Thank you, Minister. Accepted opposition.
Thank you very much, Mr. Speaker. I think Health Canada actually just approved the RSV vaccine, and it's being distributed and paid for in other provinces in Canada. And if we look at the amount of people that got RSV last year, more than 1,500 New Brunswickers, the cost of that in hospitals in New Brunswick is more than $1.2 million. We could provide vaccines to 4,000 seniors with that money instead of putting that burden on our nurses and doctors. So I'm hoping the member opposite could describe for me why they have considered and decided not to fund this vaccine for seniors who are struggling with affordability and interested in protecting their health, like the advice of the Medical Society.
Minister of Health.
Well, Mr. Speaker, we are aware of Health Canada's decision and approval of the RSV vaccination. But as I mentioned earlier, Mr. Speaker, the National Advisory Committee on Immunization have also got this in their sights, and they are going to make a recommendation in the not-too-distant future. We will take that, plus the advice of our Chief Medical Officer, the staff at Public Health, the RHAs, the doctors involved in triage and healthcare. Mr. Speaker, we will look to the medical practitioners to make this decision and help us make this decision. Mr. Speaker, I look to the medical practitioners, the people from the National Advisory Committee on Immunization who have had years of medical training and experience. I wonder where the member opposite is getting their advice.
Leader of the Official Opposition.
Thank you, Mr. Speaker. Actually, it was the Acting Chief Medical Officer of Health of New Brunswick, Yves Legere, that advised New Brunswickers to get vaccinated because hospitals were experiencing a record high number of RSV cases last November, and it was putting incredible pressure on our system. So I would encourage the member opposite to speak with the Acting Chief Medical Officer of Health of New Brunswick, who made this recommendation, and explain to us why the seniors in New Brunswick can't access this protection.
Minister of Health.
Well, thank you, Mr. Speaker. There's two very distinct questions there. One is, should a senior get a vaccination for RSV? That is their choice. That is their decision. We encourage it. We also encourage flu and immunization and COVID-19 vaccination. There is a very long list of the vaccinations that the province covers, up to the tune of $20 million. And Mr. Speaker, I have talked to Dr. Legere, I've talked to Dr. Russell, I've talked to our Public Health Department, and again, we look to the National Advisory Committee on Immunization to make their recommendation. There's very many professionals who have made those recommendations. We will take them. And it seems that the members on the opposite side want to get on a topic and ride that topic for a long time, but we continue to promote the safe and immunization program here in the province of New Brunswick that people should take advantage of.
Accepted opposition official.
Monsieur le Président, l'une des dépenses mensuelles les plus grandes pour la plupart des Néo-Brunswickois est leur paiement de leur loyer ou de leur hypothèque. Les Néo-Brunswickois cherchent pour des logements abordables et on attend pour le gouvernement qui répond aux besoins avec des mesures concrètes. Notre équipe, nous écoutons les organisations sans but lucratif lorsqu'ils demandent un financement provisoire pour les logements abordables. Nous écoutons les experts lorsqu'ils demandent des réparations à des améliorations de notre réseau de logements publics. Nous écoutons les municipalités lorsqu'ils demandent des changements législatifs pour les aider à accueillir et à développer des logements dans leur communauté. La Nouvelle-Écosse a établi un plan audacieux, un budget clair et des programmes concrets, comme des incitatifs pour des granny suites, des logements secondaires qui rendent chez soi plus abordable. Monsieur le Premier ministre, votre mesure d'abordabilité prévue comprend-elle un plafond de loyer ou des programmes comme ceux de Nouvelle-Écosse pour rendre les logements plus abordables?
Member. The Minister of Housing.
Thank you, Mr. Speaker. Was this House asleep in June when we released our housing strategy? There are real measures in our housing strategy. There's affordability measures in our strategy. There are dollars behind our strategy. There are 19 different mechanisms that we're putting in place to help with affordability and for housing for New Brunswick. Have we done everything that can possibly be done around housing? No, Mr. Speaker. That's why when I released the report, I said we would be looking at our key indicators, seeing if we're moving the bar related to housing. And at that time, we would make adjustments and changes. It was released in June. We are not even 4 months later. There's a huge amount of work that's gone in. A lot has been put in place. So, Mr. Speaker, give us a little time. Good job, Nova Scotia, for getting yours out, but we've had 4 months to get ours in place. Thank you, Mr. Speaker.